Sciatica. Sciatica is, I often think of sciatica more as a syndrome rather than as a pure diagnosis in itself, and I'll explain why in a second. But sciatica is commonly where the disc itself compresses on the nerve in the lumbar spine, and that affects the functioning of the nerve, in which case you either have pain or changes in sensory or motor ability down the leg. Now, the interesting part about sciatica and why it can often be described as a syndrome is it is not always the disc that causes those changes to the nerve. You can have restrictions on movement, specifically within the foraminal space where the nerve exits the spine. Tethering or adhesions along the pathway or the track of that nerve can again restrict the ability or affect the ability of the nerve, which again can produce sciatic-like symptoms. Compression from soft tissue, such as muscles which are tight, or sitting in an awkward position or on your wallet or a number of other aspects, can again compress on that nerve and produce sciatic-like symptoms for some people. We can often have what's referred to as a double compression syndrome, which is where 2 points along that channel that the nerve runs are restricted, and the combination of the dual restriction causes sciatic-like symptoms. The last one, which is also a possibility, is that the nerve itself is irritated or inflamed, such as in a neuritis, which again would cause pain up and down that leg or along the distribution of the nerve, again producing sciatic-like symptoms. Common presentations, as we've touched on, is pain in the spine that radiates down the back of the leg. Typically, it does only affect one side. If it's affecting both sides, then it does raise the concern level that a therapist would have, and we would be looking to really ascertain what other things are potentially going on. Pain areas, as I say, back, buttocks, hip, and lower extremity. The pain can be mild, it can be severe, it can be sharp, it can be lancing. So there's a number of descriptors that are often used to describe sciatic-like symptoms. Numbness, pins and needles can be present. Often people talk about them within their foot, specifically toes, ball of the foot, again, depending specifically on the nerve and the pathways which are being affected. Burning sensations, leg weakness, and limping are also other common findings for this condition.